my MECs here are singing for you, President. Unfortunately, they don't have a mic, so you can't hear them. Ramaphosa, re o rata kaofela. Thank you very much. Can we please take our seats? President, I threatened the colleagues here that if they don't sing when you walk in, I'm not going to acknowledge them. So they are trying to make up for that. Welcome, Your Excellency President Cyril Ramaphosa. Let's also welcome the Minister of Health, Dr. Joe Pahla, Premier, who were with you yesterday. You are welcome, distinguished guests, ladies and gentlemen, pillars, lead pillars who were assisting us as we were engaging yesterday and early this morning. Mr. President, I had the honor of being a co-chair of this summit. It has been very fruitful. It is work that we did together with Professor Konda Perez. We really appreciate the work that you have done, Prof. Prof comes from the Faculty of Health Sciences in the University of Cape Town. The conversation that we had has been rich, frank, stimulating, and inspiring. Some of the discussions might not have been very welcomed, but we had them nonetheless because they were necessary for us to have them. Some of us might have been uncomfortable with some of the discussions, but they had to be had. I think, President, you can be very proud for convening such a powerful summit, and you must be proud that you have been able to bring all of us together from the whole sector of health, not just government. We have people that come from business who are here, continue to be here with us. We have people who are our different partners, World Health Organization, and we have people who are following us online as well who wanted to be part but could not be physically here. So, President, we really appreciate the work that we have done. You have given us an opportunity to engage as the health sector, and we think the outcomes of these engagements are indeed going to be very fruitful. But at this point, I wish to then call on Professor Shisana, who is the Special Advisor on Social Policy to President Ramaphosa, to take us through the highlights of the meeting and brief the President of what our engagements have been, recap for the rest of us on how the meeting went and what are the decisions that we have taken. Professor Shisana, you are welcome to the floor. I saw her earlier on. Oh, there she is. Thank you, Prof.
Thank you very, very much, all of you. I hope the mic is at the right level, given my height. Well, first slide, please. Okay. What I'm going to do is essentially to reflect a synopsis of key achievements. I'm going to reflect on the priorities, the key priorities and interventions for 2024 to 2029 across the 10 pillars. Thank you. What I'm going to present is going to be an abbreviated presentation for some of you who have had a much longer presentation. And the reason for that is that the President has got a short time, and therefore we have to make sure that he gets the gist of what happened. On the next slide, I'm going to talk about highlighting the key achievements. And here I've got the two slides that are going to address this. One is that human resources for the health strategy for 2030 was published, and it includes the human resource for health plan for 2020 and 2021 up to 25. We said we're going to lift the moratorium on the recruitment of appointment of health workforce. That has been achieved. We also said that there will be procurement of medicines and medical devices centralized in a way that would make it easier, for the country to be sure of where the resources are, where they've been spent on. That has been achieved. We agreed on having a backlog on medicines registration to be cleared by SAPRA, achieved. We wanted to have a resilient supply chain during COVID-19 pandemic with immediate availability above 85%. Glad to say we have attained that target. We also said there should be a framework for infrastructure delivery and procurement management. It's now well entrenched in the project management information system and it's already being implemented. We revised that IDMS framework so that we can clarify accountability roles and functions for public health infrastructure between health and public works. That has been done. We've revised it. We have quantified the gaps between existing supply and existing needs for nurses in South Africa. And we have also identified and sorted out the issue of the private sector so that it can ramp up its capacity to offer new nursing qualifications so that the spare capacity that exists for nurses and nurse specialist training in the private sector can be used for the benefit of the country. And fortunately, we have had HASA, which has supported BUSA in conducting an analysis of how many specialists do we need in our country and how many do we have. That has been done. On the second slide, I'm looking at highlights with regard to the medical legal case management. You have heard today from Advocate Motibi on the challenges with medical legal. Well, let me say that we have managed to do case management and service provider systems. We've developed them and we've distributed those across provinces. And when I say we, I'm talking about all of us. This is not about the Department of Health, but it's all those that signed the compact. So there's new litigation strategy that has been adopted. On the quality improvement side, we have 183 quality learning centers, with 50% of those being in the public sector facilities that are implementing the National Quality Improvement Plan. And this is really great because as we move towards NHI, we need to make sure that the health system is improving. We also committed to costing report of the preventive and primary healthcare package. It's now complete, and we're happy with that. And we also said that we must have an assessment tool to measure the functionality of clinical and hospital boards. We've developed that. The guidelines for monitoring the effectiveness of boards have been reviewed, updated, and piloted already in 511 facilities. On the community side, obviously, the People Living with HIV/AIDS Sector Initiative called RETSIDE has already done quite a lot of work in terms of community-led clinic monitoring so they can assess the quality and accessibility of services in 400 clinics in 27 districts across all provinces except Northern Cape. Surely we still need to do more, but we've really started. And then also the Community Matters app, which is a community-led monitoring platform, has been developed to document and respond to violations experienced by community members as they seek health care, with 250 community mobilizers located in 25 districts across all 9 provinces. But there were also some building blocks, for digital health, because health information system is very, very critical. We have now a health patient registration system, the electronic vaccination data system for COVID-19, the Master Health Facility Data Center, which is hosting all of this information. We also have a health information exchange or health normative standard framework suite for clinical coding recommendations. So we really have made quite good progress. So now I'm just going to talk more about what exactly is it that we are going to be doing. Well, on the next slide, we are going to be, as a matter of priority, looking at equitable distribution of human resources. Here we want to ensure the improved monitoring through annual reporting for remunerative work outside the public service. And we know that this has been a big challenge. It's a perennial problem that we've been having for a very long time. But now we need to make sure that we've got a monitoring system on an annual basis. We want to establish a framework for community health workers on a collaborative among several government departments, which is the National Department of Health, Department of Employment and Labor, but we also want to work with organized labor, because if you don't include organized labor on issues related to community health workers, we're only doing it at our own detriment. Fortunately, they are part and parcel of the Presidential Health Compact. We want to prioritize mental, occupational, and wellness of health workforce. We recently had a mental health conference in the country, and would like to be able to pick up some of the information that has come out with regard to the health of our workforce and make sure that we make it a priority. We also want to have a workforce data analysis, which is going to use several databases. Here we're talking about PESAL, the BHF data, health workers, and all the other private sector stakeholders, that they must collect data and share that health workforce data with the National Department of Health, because our Minister of Health is not a minister of only public health, but is a Minister of Health of the public and private sector. And we also want to ensure that this health compact that we're talking about right now should actually be financed. There must be resources. We cannot have a health compact that is actually not financed. This is what the meeting concluded. On the second pillar, pillar 2, on improved access to essential medicines, vaccines, and medical products through better management of supply chain. Here are the proposed key priorities that have been identified for 2024 to 2029. That one must have a clear definition of medical products. We should know what it is that is going to be included. In addition to that, we need essential equipment list or an essential product list. And then we also need to harmonize local procurement policies and practice. So when we decide that we've got a policy with regard to local procurement, we must actually practice what it is that we agree to. And the state must move from a 28-day to 30-day packs, aligned with international pack sizes. In other words, if we want to export our medical products, we must make sure that we do have a system that's aligned internationally, because it will help us really to be able to be competitive with other countries. We must offer supply chain management as a career path, because it is not right now. And we want to develop a communication strategy for medicines availability, so that people should know that the medicine is available and where it is actually available. Continuing on pillar 2, I'm going to look at now on the proposed interventions, for the next health compact. First, we'd like to establish a parallel system for managing non-pharmaceutical products with similar government processes to those that are used for medicines, because currently they differ. We would like to have appropriate skilled personnel to be appointed to manage non-pharmaceuticals. At the moment, we are not really strict with regard to making sure that people are skilled to do that. We need to change that. The non-pharmaceuticals must have their own separate warehousing and possibly supply chain where it is feasible. We have to look at the economies of scale. And all SAPRA-registered products must have a single exit price in the interest of data sharing, transparency, as well as benchmarking. We must upgrade depot infrastructure, which must be aligned to modern warehousing practices. That's how you manage your system, by knowing exactly where you can obtain this, because your infrastructure must actually be excellent. We must develop a standardized organizational structure for pharmaceutical services across provinces, and they must all be aligned to service requirements. I now move on to pillar 3. On pillar 3, I'm going to look at the question of executing the infrastructure plan to ensure adequate, appropriate, distributed, and well-maintained facilities. The proposed priorities for the next compact are a few here. One must conclude the review and update of the revised 10-year infrastructure plan by the end of this financial year. We must develop and implement a software system so that we can continuously update the infrastructure plan, because it changes as they start building, or some of them become uninhabitable and therefore have to be removed or be replaced. All infrastructure projects must, to implement the infrastructure delivery management system framework, they must be able to implement that particular structure. And then facilities must be capacitated to perform ongoing maintenance. We know that maintenance is a big problem, for all of us who are in the healthcare system. We see that patients sometimes are not getting the best service because the infrastructure itself is not that good. The next slide on proposed interventions on Pillar 3. 3 recommendations were made here that are critical. We recommend to the National Treasury to improve the infrastructure development management system framework so that all the infrastructure must be funded by equitable share of the formula that is actually being used. We also must identify infrastructure projects from infrastructure review program for private funding and also perform feasibility studies before we actually implement. We must also enhance technical capacity and skills insofar as making sure that human resources are appropriate and make sure that they've got tools of the trade. On Pillar 4, we must engage the private sector in improving access, coverage, and quality of health services. The priorities for the next compact must be first and foremost to accomplish those initiatives that we agreed to and signed with the President and the Minister of Health in 2018, together with all of the key stakeholders. We must address those regulatory barriers to urgently address the looming crisis of nurse and doctor shortage. And we must do that also to take into account other health workers by making full use of the private sector capacity to complement public training. The capacity in the private sector is great, it's got infrastructure and everything, and it's underutilized. And if we want to talk about one healthcare system, we obviously have to make sure that we integrate the private sector into what it is that we're doing. We must refine a blueprint for public-private clinical collaboration using the service level agreement templates which were developed during the COVID-19 so that we can enable sustainable clinical collaboration between the public and private sector. We did exceptionally well during the COVID period to integrate the services of the public and private sector. We must include all scarce health worker skills in the critical skills list to provide temporary relief for service delivery pressures in public and private sectors. The Minister of Health or the Director General should engage the South African Law Reform Commission to resolve the perennial problem of medical legal disputes through a law that enables alternative dispute resolution. We've heard a lot about this from several pillar leaders. What are the proposed interventions? And that's on Pillar 4. We're very pleased that the private sector supports national health insurance. That was really exciting to hear. They've reported it here, so it's really exciting because that has been a big challenge for a very long time. The Director General must set up and lead a platform for sustained inclusive dialogue on feasible collaborative service delivery initiatives as the pillar leaders have requested. The National Department of Health-led platform must be set up to enable the sharing of knowledge and learnings across the public and private sector on systems and processes in health facilities similar to those that were used for the COVID-19 PPE and vaccine rollout in a collaboration. The Department of Health really should recommence on the process to oversee the engagements required to remove regulatory barriers to nurse training, which is not happening. Technically speaking, this is the issue that should be addressed by the South African Nursing Council because they are the ones that determine whether you've got enough clinical training platform, in order to train more nurses. The SACOM as well as the HPCSA must lead an inclusive process of onboarding suitable private facilities to postgraduate training of doctors. So we need more spaces to be able to train doctors so that they can get good practical experience. On Pillar 5, which addresses quality, safety, and quantity of health services should be provided within a primary health care environment. And the proposed priorities for this particular compact, the new compact that will be developed, is to implement the medical legal declaration. There is a declaration that exists. It needs to be implemented throughout the whole system. We have to develop staffing norms so that at least we can be able to compare ourselves with other countries. We must align and harmonize the National Quality Improvement Plan with the earlier program that the department was running, which is called the Ideal Clinic, which is still going on. Harmonize those two so that we can be able to make quick progress. We must monitor, evaluate, and document clinical outcomes so that we're able to know what has happened, to the patients that we've seen and we treated within the system. With regard to COVID-19 structures, we need to be sustained with leadership from the premiers and the president at national level. We need to revise package of care for priority populations so that we can include Office of Health Standards at different occupational health standards at different levels of care. We must prioritize TB in the mines, which is something that we keep forgetting as health workers, that TB in the mines is a very big thing. It needs to be included as part and parcel of the primary health care package. We must roll out the mental health and drug-resistant TB policy mandates across the entire healthcare system. Furthermore, we must have international benchmarking on procurement of therapeutics and diagnostics so that we are able to compare ourselves very well. We have to increase or improve access to palliative care across all levels of care in the public sector. Now, coming into Pillar 6, which really relates to the efficiency of public sector financial management systems and processes. We have priorities that we've identified. Mr. President, this is the area where we've got a lot of challenges in terms of managing our financial resources. If we can just improve our allocative efficiency and track the expenditure very well, we probably will do much better in terms of the resources that we have, given the fact that we spend about 9.2% of the GDP as a country on health, and yet the public sector is receiving very little of that money for the population that it has to serve. So we need audit findings, irregular and fruitless and wasteful expenditure and accruals in provincial health departments, and they are done, but they point to an ongoing lack of financial management capacity. Major effort that is led by the Department of Health Finance, the finance team, needs to be implemented to increase staffing, expertise, and dedication, the drive, the motivation to do so, especially in the provincial health finance departments and their senior management teams. They need to work harder on that. Accruals and medical legal claims are a significant pressure on the provincial health budgets. Provinces that make progress with managing down their accruals and medical legal claims, like the Eastern Cape, should be rewarded for progress with additional allocation budget, and they must be incentivized to be able to continue to do this kind of work. Provinces that show no progress, they are saying, please, Mr. President, do not bail them out. Improvements in service delivery can be generated through efficiencies and reducing the non-essential administrative costs, including reducing corruption, because if that money that is going towards corruption was used to be spent on healthcare, it will take us a little bit further than we are doing now. The view of Treasury that 7.5% salary increase will have to be funded by reducing headcount, we are saying that it's unsustainable, and it must be addressed in the adjustment budgets. All stakeholders, including unions, must lobby Treasury and the Department of Public Service and Administration on this particular regard. Now I come to pillar number 7, on strengthen governance and leadership to improve oversight, accountability, and health system performance, at all levels. The following actions were recommended: that we strengthen accountability mechanisms at national, provincial, and institutional level within the current constitutional framework. We must ensure effective oversight through robust health information, research, and evidence. Everything we do must be evidence-based. We must provide effective oversight and policy guidance across the health sector. And most importantly, we must address corruption decisively. We must update and reinforce health sector regulations to improve quality, transparency, accountability, and efficiency in the health sector. And here we're talking about not just the public sector, but also the private sector. And coordination across the health sector and building strategic partnership is going to be critical, because if we work alone, we will not go too far. On Pillar 7, next slide, on proposed priorities for the next compact of 2024 to 2029, we must evaluate the work done by the Health Sector Anti-Corruption Forum since 2018 and annually. Mr. President, we missed the presentation that was given by the Health Sector Anti-Corruption Forum that has indicated progress that has actually been made, including with the proclamation that we have given them. They've been able to use that in order to track some of those resources and recover some of them, the resources that were taken away. But they still have a lot of work to do. We need to regulate the training and the practice of community health workers. Community health workers are supposed to be integrated as part and parcel of the primary healthcare system. And we need to regulate that so that there can be uniformity in terms of the way in which they practice. We need to formulate and implement agreement between the public sector, that is in the provinces, and the private sector, that is the hospitals, about the remunerative work outside of public service and the moonlighting done, by nurses. Here, Mr. President, we have employees that are employed in government, and they also do work in the private sector, and they come back on Monday or after they've worked very tired and not being able to provide the services. That needs to be regulated, monitored, Mr. President. We have to implement health information sharing between the public and private sector, which I talked about earlier on. We must implement more targeted research by the consumers of research information, that is produced. In terms of new interventions, on Pillar 7, we must establish the National Health Commission, that's a new one, a new structure, to drive intersectoral action to address the social determinants of health. There's always a concern that when they look at the National Health Insurance, they believe that this is what it should be doing. But they have clarified here that there is a need for a separate body that is actually going to look at intersectoral action to deal with non-personal health services. They are proposing and implementing the health market inquiry recommendations so that we can achieve structural changes in the private sector. The private sector needs to be regulated a bit more than it is currently now. All the MECs of health must establish a position of coordinator of hospital boards and clinic committees in their offices so that they can provide a communication line between the community as well as the health system. They are recommending to allocate a portfolio of leadership and governance to an executive in the National Department of Health so that there is someone dedicated to do this work. And they must develop and test the delivery model for the National Health Insurance. In terms of Pillar 8, there is a need to establish a decentralized election of government committees through changing of the National Health Act so that it can empower people at the district level to shorten the turnaround time for appointment and use that model that is used in the education sector with regard to SGBs. We must encourage advocacy for individuals living with non-communicable diseases within the community, and this we are talking about, heart disease, diabetes, cancer, and so forth. We must emphasize diversity within the committees, advocate for inclusion of all populations, younger people, female sex workers, people with disability, patient user groups, and make sure that we implement a multifaceted approach that takes into account the needs of all of these groups. We must define community engagement frameworks. There must be a checklist for quality of assurance community interventions to see whether all of them that are supposed to be implemented should be implemented. We must strengthen and establish structures that support patient care, for example, the KZN Sakumasake, so that we can help community engagements. On the next one, on proposed intervention for 2024, on Pillar 8, we need skills development to fill the gaps, the training of community health workers and health workers to improve service delivery, integration, community engagement skills, and integration of all of that into primary health care. There must be resources, we must resource community feedback loops so that we can give community leaders power to lead and engage with clinics and hospitals and so forth. We must develop a clear partnership framework from the Department of Health for relationship with community-based organizations so that it can enable improved access, and functionality. And we also must restructure clinic committees to include diverse and vulnerable populations. We tend to include the same people that look like us. We must include people also that do not look like us. We must conduct community-based dialogues with demand generation where all populations are represented and can be reached through radio, arts, and so forth. We must also be including people, the LGBTQI, community. What are the proposed priorities for 2024 to 2029, still on Pillar 8? We must continue with the current Pillar 9 priorities. We must accelerate the development of an electronic record. We must review the current digital health strategy and develop the 2029 roadmap. It must be very clear in terms of what needs to be done. And there has to be a digital health governance framework that is going to assist in everyone knowing where they should be going. To align policies and legislation around the digital health, we need to do that. We must promote intelligent use of data and information, and also there must be capacity building and skills transfer with regard to digital health. And those who are in the private sector have got these particular skills. Can you please share it, with the public sector? Or can you actually transfer some of those skills? So the next one on Pillar 9. Pillar 9 is supposed to be addressing, can I get Pillar 9, please? That's Pillar 9. I don't see Pillar 9. I should have worn my glasses. Okay. On Pillar 9, the priorities for 2029 is that we must continue the current, no, I've just gone through that one. Next one, please. All right. Pillar 9 has been skipped. But Pillar 9 is about health information system, Mr. President. There's been a lot that has been accomplished with regard to Pillar 9 in terms of making sure that more than about close to 60 million people are already on the HPR system that the department is busy preparing in order to include it in the National Health Insurance. So it's really critical that we make sure that we work together between the public and private sector, make sure we collect data across the system, regardless whether you're public or private, to really make sure that the health system is able to utilize the information to provide quality health care. An individual must be able to move from one facility to the other and be able to get the information there so that the doctors don't have to say, who saw you, what happened, did you get treatment, what kind of treatment. That shouldn't have to happen. Can I go now to Pillar 10? The Pillar 10 is a new intervention, Mr. President, and it has to do with the work that you've been doing at Act A, at the African Union, where you have spent an inordinate amount of time trying to harmonize approaches across the continent and globally in terms of preparing for the next pandemic. So for South Africa, we decided we needed something that we can really percolate it down from the global level, from the regional level, to the country level. So there are several principles that we've agreed upon. One is that there should be predetermined, pre-existing mechanisms and contingent financing, day zero and surge that we should be using. We shouldn't be creating new structures, but try to use what exists and make sure that those mechanisms are funded from the first day when the pandemic hits a country. We must address and embed provisions preemptively in the various acts that have a bearing on good health outcomes. So we must be selective in terms of what it is we're going to be doing preemptively. We must use a securitized approach to mobilize resources. We know that some people were saying securitizing health may not be a good thing, but what it does, it allows you to do exactly what you did when you had the COVID-19 pandemic, you put in resources that address not just the medical countermeasures, but also address the issues about poverty, about unemployment, about all of those things. So if you securitize the approach, it helps to mobilize resources beyond the health ministry. And then also the high-level leadership is necessary. There must be strong institutional capacity with a transparent legislative mandate at all the levels, and it must be agile in response to the pandemic. We must ensure public-private partnership and a whole-of-society approach, and make sure that you access data wherever it is, whether public or private, it must be accessed and be used. And we must ensure that health system strengthening and continuity of essential health services during the pandemic is critical. We've seen that during the pandemic, many people were not able to go and get services. We heard earlier today that HIV/AIDS patients now are coming much sicker than before COVID-19, simply because some of them did not go out to get health services, or the health services were actually not available because we had shifted our eye onto COVID-19. And the capacity we need to capacitate human resources for preparedness and response during pandemics, and building HR search capacity. And then, of course, there should be appropriate evidence-based case management. Every case should be managed according to the latest scientific evidence, and then must build disease intelligence in the system through surveillance and epidemiological investigation. And that is what we used. He used when it was dealing with the question of COVID-19. We just have to transfer that to the entire healthcare system. And of course, we have to deal with the local regionalized manufacturing capability, which will be crucial for us to secure access to medical countermeasures. Now, I think this is the last slide, or no, two more. Let me be quick on this one. On Pillar 10 on interventions and key activities, next one. We need to identify pandemic preparedness and response principle for South Africa. We need to develop and implement legislative measures. We need to implement coordination structures. We need to develop and process systems and roles and responsibilities, accountability mechanisms for financing, and we must develop and implement an integrated surveillance strategy. And the next one, we must develop a medical countermeasures platform for our country. We're busy doing that at a global level. We're having a meeting at the World Health Organization on the sidelines of the World Health Organization in May to really develop a medical countermeasure platform at a global level, taking the discussions from the Johannesburg Forum. There must be resilience of and continuity of health services, which I addressed earlier on, and of course there has to be capacity building human resources. But most importantly, there should be communication risk, and especially risk communication and community engagement. It's very, very important so that we can be able to support, promote, utilize, and leverage existing structures for risk communication and community engagement as core to what we do. Mr. President, this is what took place. The team has worked very, very hard throughout all these years, and today is the culmination of the work that they've done. Thank you very much.
Thank you very much, Prof. Sisana, for that recap. It is an accurate recap of our discussions, and indeed, we have a collective responsibility to ensure that all the matters that were discussed today are and agreed upon are implemented and are implemented on time. We really appreciate that. Can I then quickly go to the Minister of Health, Dr. Phaahla? Welcome the Minister. It's my great pleasure, Minister, to welcome you back so that we are able to introduce the President to us. Welcome to the Minister.
Well, thank you very much. I'm sure it is indeed an anomaly to say I must introduce the President to the people who know him very well. Mr. President, on behalf of the 750 delegates plus not minus, gathered here, and on behalf of close to another 700 online plus, we wish to welcome you to your summit. Because as you can see, this is your summit. So we welcome you to your summit. I want to say, I'm sure I'll be speaking on behalf of all the people gathered here, that we are indeed very appreciative of your leadership, having initiated the first summit in 2018, which laid the foundation for very rich discussions, as you have heard from the reports from Professor Shisana. So all of us gathered here do really, we don't take for granted the leadership which you provide for us in the country, as we have seen also after the summit, after the compact, when we were all, the COVID-19 befell on us, you again rose to lead us in making sure that we could navigate that difficult situation. I'm sure many people have suddenly forgotten the family meetings. And many are still looking forward to those family meetings. But we also appreciate the leadership which you have shown beyond just our country, in the continent and also in the world. So I must say that to those who don't know, President is also part and parcel of the health sector. He is. He may not have gone to nursing school or medical school or pharmacy school, but he is a doctor by marriage. So, as we appreciate all the good work, all the leadership, we must thank somebody who is not here, Dr. Tsepo Motsepe. We say, Mama, thank you very much, because we believe that a lot of what the President is able to lead us is not because of us, the professionals, who are active, but somebody, when the President is nice and relaxed, is able to guide him to say, please attend to this, please attend to that. So on this note, I want to please invite His Excellency President Matamela Cyril Ramaphosa to come and address us as we conclude the summit. Thank you.
Thank you. Let's be seated, please. Program Director, Minister of Health, Dr. Joe Pata, Deputy Minister of Health, Dr. Spongiseni Zomo, Premier of Gauteng, Mr. Panyaza Lesufi, MECs of Health and other ministers who may also be here, and traditional leaders here present, and representatives of the healthcare fraternity, and representatives of academia and the scientific community, and representatives of the World Health Organization and other international health bodies, and representatives of business, of labor and civil society, delegates here in the room and those participating virtually, and all of you ladies and gentlemen. It's a real joy to be here, and thank you for welcoming me to my summit. Dr. Pata doesn't know that every day when I get home, I'm always asked, how was your day? And I have to give an account of this and that, of course, not so much detail, but having attended this session now, when I get home, as a doctor by marriage, I'm going to be expected to know everything about all the pillars. So I was listening very intently, Professor Shisana, to your report, and I found it quite fascinating that so much work has been done. Just as much work as was done after the very first presidential health summit. And I'd like to applaud you all for the incredible amount of work and with a tremendous amount of detail that has been reported here. And Dr. Shisana, thank you very much. You may well have helped me get my meal at home, because I will repeat everything that you said when I get home. It has been 4 years since the Presidential Health Compact was signed at the inaugural Presidential Health Summit, which was quite a milestone event in that we brought together so many people, people from government, business, labor, civil society, the health sector, health professionals, unions, and it's always is amazing to get to remember how many people were brought together to develop short and long-term solutions to challenges facing our country's health system. It demonstrated, as it does even today, the seriousness with which all of us approach the health system in our country. As we know too well, it was not that long after that summit took place that COVID-19 descended on us. And in the words of the World Health Organization, it was the most severe health emergency the agency had ever declared. And for us, it was a real catastrophic moment, particularly our people who were facing an unprecedented challenge. And beyond its toll on human health worldwide, the COVID-19 pandemic also triggered the most serious economic crisis since the Second World War. It was a time in which countries and national economies had to take or embark on sharp detours when it came to funding and having to allocate resources away from the normal health programs and just to focus on the COVID-19 pandemic. With financial and other resources being diverted to fight this pandemic, a lot of other health priorities had to be put on the back burner. And I recall, even as we navigated our way through this, I kept on getting extremely worried about what and how we were implementing other programs and whether we were focusing on a whole number of health challenges that our people are facing. There are ample studies showing the impact of COVID-19 on routine immunization, reproductive health care, non-communicable disease management, maternal and child health care, and other services. With the pandemic now in abeyance, it is a case of having right now to play catch-up for many countries, and including our own. And I guess as we do catch up, we are discovering the damage that was wrought during the period we were fighting COVID-19 on many other fronts. Even though countries like South Africa were particularly negatively affected by COVID-19, we should say, though, our health system has proven to be remarkably resilient. And that is something we have to be grateful for. And our gratefulness has to extend to many of you who are gathered here as healthcare workers, as even academics and scientists, and many, many of you, the unions and what have you. The pandemic disrupted the implementation of the 9 pillars of the compact. We have had mixed results, including with the apex issue of the National Health Insurance and establishing a National Public Health Institute for South Africa. But work did not grind to a halt, and as it should never have. To the contrary, it continued despite the difficult terrain that we were navigating at the time. To use the old adage, every cloud is said to have a silver lining, and even as we went through COVID, we kept saying, this does have a silver lining of one sort or another. Having a health compact in place actually gave us what we could call a launch pad from which to build on a coherent, highly effective pandemic response that was acclaimed around the world. We were also fortunate in that we put the legislative wheels for NHI in motion before the pandemic had struck. The NHI bill was introduced in Parliament in 2019 and has been processed through the parliamentary program since then. The bill is now expected to be debated in the National Assembly in June of this year, and then considered in the National Council of Provinces. Now, implementing the pillars of the compact are key if our country's health system is to be prepared for the NHI. So what we are doing here is really preparatory work for the health revolution that needs to take place as we implement the national health insurance. At the same time, we recognize the need for agility and adaptability in response to both prevailing conditions, but more particularly with regard to the lessons that we have learned. For this reason, stakeholders have called for a stock take of our COVID-19 response and its learnings as we resume the pathway towards NHI. Also, on the issue of agility, the world and the African Union are negotiating pandemic prevention, preparedness, response, recovery mechanisms to ensure a far more preemptive and protective approach to future outbreaks and epidemics and pandemics. As a country, we've been fortunate in this regard, having been appointed a COVID-19 champion by the continent, which has put us right at the center of what we need to do, not only to have responded to COVID-19, but also how we need to prepare for future pandemics, as Professor Shisana said. We have therefore resolved to add a 10th pillar, as we had, to the health compact, the pandemic prevention, preparedness, response, and recovery. I've had the opportunity to go through the robust summit program, and I've had sight of some of the presentations and discussions that have taken place over the past 2 days. I've also received the midterm review report. Though there has been progress, there is still quite a lot of work that lies ahead of us. We have to reassess and redefine our country's health priorities to align them with, firstly, the attainment of the Sustainable Development Goals by 2030. And secondly, the African Union's public health order announced ahead of the 77th UN General Assembly last year. The AU's new public health order is a continental health security policy that is anchored on 5 pillars, and these are respectively: strengthen public health institutions, and we need them desperately on our continent; financing of health, which should really underpin the continent's ability to have a robust health system; attaining biotech sovereignty through local pharmaceutical manufacturing, a process that was really strengthened as we navigated our way through COVID-19, and we called for the world to support us as a continent so that we can be in a position to manufacture our own pharmaceuticals, from vaccines to diagnostics and therapeutics, and also an action-oriented partnerships as we forge partnerships with a variety of partners across our continent and across the world as well. Now, South Africa is a signatory to the UN's Agenda 2030 for Sustainable Development, the SDGs, and is striving to implement the SDGs. Now, achieving universal health coverage falls under SDG 3, namely good health and well-being. The aim is to ensure that everyone can access quality health services without having to incur inordinately high financial costs, that is, incurring high or financial hardships. The aim, furthermore, is to promote health equity and to actively reduce health disparities by providing essential health services to all individuals, regardless of their socio-economic status or geographic location. To achieve this, health systems need to be strengthened, health coverage needs to be expanded, and out-of-pocket expenses for health services need to be reduced. Now, promoting universal health coverage and achieving sustainable development relies on collaboration between governments and clearly civil society organizations, but also importantly the private sector and other stakeholders. Now, as a country, we've come a long way towards creating one health system for all. However, we must all admit that disparities between the public and the private healthcare continue to increase. Moreover, despite efforts to integrate health departments, quality of healthcare is still largely influenced by where you live. If you live in the deep rural areas of our country, your healthcare access and also the quality speaks to that distance from where it is ordinarily available. The objective of NHI is to provide access to quality healthcare services for all South Africans, regardless of their socioeconomic status or geographic location. It aims to reduce health disparities between different population groups and regions of the country and to protect individuals and families from the financial burden of healthcare expenses. The journey towards NHI requires working with key stakeholders to prepare the health system of our country to accommodate the entire population in one system and ensure all can access quality health care. And we have been able to establish many one systems in a number of aspects of South Africa's people's lives. And this is the one that many South Africans are waiting for. Our vision is to create a world-class health system, accessible to all citizens, regardless of their socio-economic status. It is to ensure that every citizen can access good quality health services and receive the right diagnosis, as well as treatment at the right time for free at the point of care. That is what is important. I say cheers to that. Such a healthcare system should be adequately staffed, We should have really good professionals who are dedicated, and the types that we saw during COVID. The work that was done by our health professionals, our scientists, our, doctors, you name it, our nurses, was quite heartwarming. So heartwarming because they were so dedicated. We were all united in fighting this pandemic. And we therefore need a healthcare system that is well staffed by great professionals, supported by effective management and leadership as well. To achieve this vision, government must prioritize several key areas. One of those, and the key one, is the funding one. We need a well-funded health system. And I think you will applaud to that. Resources will need to be pooled to provide access to that quality health care for all, starting with, yes, government's funding health services that have experienced a massive budget reduction in the past few years. This I too will admit. We have cut back and cut down through reprioritization and all that. Moving forward, as we introduce our NHI, we must insist, and you too must insist, that our healthcare system must be well funded. I heard Professor Chisana agitating all of you, and yes, you can be agitated because we do need a well-funded healthcare system. We will also need to mobilize resources. But before I even get there, a well-funded healthcare system will also need to be bereft, the funding needs to be so well managed so that the corruption that we always find in healthcare must be obliterated and removed. Because it is like, all the crooks and the thieves have conspired that it is in healthcare where they are going to plunder, where they are going to siphon money out, and where they are going to steal. So making funding available should mean that we need to use that money properly. We need to watch the money that is given in the health sector like a hawk's eye and make sure that it is properly used. And no overcharging, no overspending, or no incidents of non-spending, because sometimes money is not spent because people are trying to find ways of siphoning the money out. So that in itself should mean that money is made available and it is well spent. We will also need to mobilize resources to address perennial problems such as HIV, tuberculosis, and other non-communicable diseases. Secondly, we need strong governance and leadership by the Department of Health at national level, at provincial level, and yes, also at local level. This is to ensure that the entire health system, public and private, is well managed, is transparent, is accountable to the public. In this regard, we look to partnerships with civil society to improve oversight and accountability. The Department of Health should be at the forefront of highlighting the importance of health for economic development as well as social well-being. And thirdly, stepping up investment in healthcare infrastructure. We have to upgrade existing healthcare facilities. Yes, we've got to do that. We need to build new ones where necessary and ensure that they are properly equipped with the latest medical equipment and technologies. A few days ago, I went to Matlosana, and when we were there, we saw this community health center, really world-class, that serves 54,000 people, and they told me that they see 5,000 people a month, but they also have this new device, the device where people who come for chronic medication just send a text message, and that is prepared, and they go to their cubicle, they go and take out their medication, then they move on. So I was hugely impressed by that, being a person who loves gadgets, and I think many more health centers in our country should have something like that. We should not have our old people queuing up for hours and hours just for their medication. That should be something of the past. Fourthly, we need to develop a motivated, capable, compassionate workforce, and working with medical schools, nursing colleges, and other healthcare training institutions in this regard, so that those who are at the front line, front desk, who are treating our people, should demonstrate their compassiousness. They must demonstrate their care. The arrogance that sometimes seeps through, that one sees, should be something of the past. Our people must be taken care of with delicacy, with a real love and compassion. Government must invest more in training programs for healthcare professionals and increase staffing levels to meet the population's needs. We have heard from the Labour at this summit on the critical issue of increasing human resources in healthcare, and that community healthcare workers should be integrated into the national health insurance, and I agree fully with that. That is something that we should do, because if we are going to demonstrate our seriousness with primary health care, it is these frontline workers who know every street in our country, who know every little hill in our country, who are the very best foot soldiers, healthcare workers who should be brought into the NHI and be of great use to the healthcare of our people. Fifthly, we need to ensure that essential medicines and medical devices are available in all healthcare facilities, including in rural areas and points of access closest to the people like community pharmacies. I went to I think a district hospital in Tzaneen, in Limpopo, and saw how in a village they have x-ray machines, they have mammography machines, they have very sophisticated machines deep in the rural areas. What does that do? It enables people to go to those nearby facilities rather than travel 200 to 250 kilometers. And that is how we build a world-class health system. Sixthly, we must advance the local production of therapeutics, diagnostics, vaccines, and other medical countermeasures in South Africa. And we have to ensure that we use the opportunity to leverage public procurement spend to develop our local industries. We have to ensure that a reasonable balance is struck between considerations of price, which are naturally important, with supporting localization and economic growth imperative. And on this, as a nation, we do need to reflect, and particularly people who work in the health sector, because it's a difficult binary type of situation. What is it that is important for us? We campaign very hard globally that Africa should be able to make its own therapeutics, its own vaccines and diagnostics. And of course, when we have to face the specter of having to procure, and then price then becomes a challenge. We need to have a proper balance that will enable local pharmaceutical industries to grow, because that in itself is a really good preparatory ground for us to be able to deal with future pandemics. The seventh one is a zero-tolerance approach to corruption in the healthcare sector. I've already spoken about this, with strict measures to ensure that medical supplies and services are procured transparently and efficiently. The highly publicized situation at Tembisa Hospital and many such examples in various provinces are totally unacceptable and must not be allowed to be repeated. We must protect whistleblowers to ensure we can root out corruption that has become endemic in our health system. That we must do. And I applaud the excellent work of the Health Sector Anti-Corruption Forum. Some of the results having been presented at this summit by the Special Investigating Unit. As the Presidency, we will continue to work closely with the Department of Health, professionals, the labor movement, business, service users and providers, civil society, regulators, to ensure everyone is on board with our vision and is committed to making it a reality. We also aim to step up engagement with communities across the country to make them much more aware and to understand the NHI. And because it's a new concept, people do need to be made more and more aware of NHI and how it is going to work and how it is going to benefit them. But we also need to outline more clearly what the rights of our people are going to be and how they can access the services. NHI, as I said, is going to be a real, meaningful health revolution in our country. The government, the private sector, civil society organizations and individuals should work together to create a society where everyone can access the resources needed for a healthy life. And I'm very pleased, Professor Shisana and Dr. Pasla, to hear that the private sector has and is welcoming NHI. And I applaud them for coming to that point. And as government, we are committed. We are committed to working with the private sector to make sure that NHI works. And of course, because it's going to be a new system, it is going to have its own teething problems. Inherent in it will be challenges, and these are challenges that we should work together to address, to find solutions. Now, working together includes implementing policies that address poverty, that address education, housing, transportation, and environmental factors that impact health outcomes. By addressing social determinants of health across sectors, this country could promote health equity, reduce health disparities, and ultimately create a society where everyone can live a healthy life. At this year's UN General Assembly in September, we hope to attend the UN high-level meeting on universal health coverage to confirm our global commitment to achieving universal health coverage by 2030, in line with the Sustainable Development Goals. It will be an opportune moment and time to share with the world the progress that we as South Africans have made since 2019 as we have progressed towards national health insurance. We've been able to learn from the experiences of others, as well as to adopt best practice in implementing universal health coverage in terms of policies as well as in terms of programs. ahead of this UN high-level meeting, we will also converge at the African Union mid-year coordinating meeting to ensure that we are aligned as African countries. Our goal as South Africa is to create a healthcare system that we would like to be the world's envy. World's envy because we've come from a history of the worst inequality, the worst inequitable system. And as we move forward and embrace a universal health coverage system, we would like the world to be able to look at us and say, they did not only overcome a diabolical system called apartheid, they have also overcome a system that excluded the coverage of health properly of all the citizens of this country. And that in itself will stand out and could be the world's envy. So by working together and focusing on our shared vision, I am sure that we can create a brighter future for everyone. I do firmly believe that the National Health Insurance is going to be a great marker in the history of this country. 27th of April was an unbelievable marker where we differentiated ourselves and where we were able to cast inequality and apartheid to the past. And now with healthcare, this is going to be the new revolution that we all explode on. And I'd like all South Africans, even those who are doubtful, who are fearful, who are agnostic, and who just feel that this is not a necessary progression forward, to embrace it and to look at it from an equity point of view and an inclusion point of view. The entire world is being urged to move towards universal health coverage. And as South Africans, we cannot be left behind, and we cannot continue with a health system that does not speak to equity, that does not speak to universal access. This we have to do because we are South Africans. We always want the best for all South Africans, and NHI is the way to go. Thank you very much.
Thank you very much, Mr. President, for those wise words. I think the President deserves another round of applause. Indeed, President, we need a well-funded health system in South Africa. With that commitment just on its own, I think all the MECs, majority of our challenges will be sorted out. The challenges that we have had of being unable to employ doctors in other instances, being unable to employ nurses that we have trained ourselves will actually be sorted. That is just some of the things that will be addressed with that commitment. We appreciate that very much. President, we wish to thank you very much for the wisdom of ensuring that we actually have this engagement. Because if it was not for that wisdom, I do not believe that we would have had an opportunity to come together as a sector and collectively discuss what needs to be done in the health sector for us to be able to attend to our challenges. We appreciate that very much. We appreciate the fact that you've also elevated health to be a priority of the South African government. Siyabonga kakhulu ngalawo mazwi. With that said, I wish to call on Deputy Minister Ubaba Udlomo to come that we are making as a health summit. Siyabonga kakhulu Tinangwe, we are on your hands.
Director, President, us, all us as participants, find ourselves in this pledge. It's not asking me to elevate the request you to stand. It's your choice, person. We've really made a very strong commitment here. But may I request those online and ourselves in the House to stand as I lead. I will read, coincidentally, is 10 points with the 10 pillars that we have just received. I will read the whole one sentence, and then we come and follow me. In the name of universal health coverage, I pledge to one, recognize and uphold the United Nations Sustainable Development Goals, in particular Goal 3.8 on the attainment of universal health coverage. Oh, so I read and you say agreed? Yes. Oh, great. I'm learning. 2, recognize and uphold the country statement made at the United Nations high-level discussion on the universal health coverage, which commits South Africa to realizing universal health coverage by 2030. 3, keep my promise by honoring this pledge with tangible action that pursues the attainment of universal health coverage. Encourage constructive dialogue that contributes to a future where universal health coverage is a reality. Individually and through strategic partnerships, contribute to primary health care strengthening as a tool to realizing universal health coverage. Commit to the United Nations 2030 as a compass towards the attainment of universal health coverage. Respect, protect, promote, and fulfill the right to the health care for every South African citizen and every child as enshrined in Section 27 of our Constitution and adhere to our international treaty obligations. Leave no one behind the quest for universal health coverage. Become an advocate for universal health coverage within communities and create awareness of the benefits of universal health coverage. Lastly, Uvuma, actively support the nation's health insurance bill and foster a culture of accountability as a rational means of attaining universal health coverage in South Africa. Siyabonga kakhulu, Mongameli.
Siyabonga kakhulu, Dinangwe. We may be seated. Thank you very much, ladies and gentlemen. We have come to the end of our summit. Indeed, we had a very fruitful 2 days. We would like to thank the President profusely for honoring the summit. We know that your schedule is quite tight and there's quite a few other things that are more urgent that you needed to attend to, but you took time to come and honor us. We really appreciate that. A word of thanks also goes to the respective MECs from the different provinces. We also appreciate our host, MEC, for being here and participating. We appreciate the Director General and all heads of health in the different provinces. We want to also appreciate and honor all the delegates that are with us, those that are physically here and those that are online. I have also appreciated Professor Perez, and I wish to emphasize that we are very grateful for the work that you have done. Your 2 days was not very easy. I did not wish to be you, Prof. I also wish to thank the constant guidance and support of the President and Minister of Health in shaping the form and direction of the summit. On behalf of the National Department of Health and the entire health sector, let me express my gratitude to all the speakers for their excellent and thought-provoking presentations. COSATU. Yesterday we had a direct jab from COSATU, but we did appreciate that, which created the right atmosphere for all the lively discussions and debates that we've had over the past 2 days. My gratitude also extends to the scribes, facilitators, and leads of the breakaway sessions for their important contributions. As part of our reflection on some of the deliberations that we had at this Presidential Health Summit, we welcome the call for the annual evaluation of the commitments that have been made here today. This will go a long way towards ensuring the effective monitoring and evaluation of what we have committed to. This is the only way that these commitments will find expression through action and implementation, rather than sitting and gathering dust in offices somewhere until they get pulled out and reviewed just before the next Presidential Health Summit. So it is important that we implement them and we have this kind of agreement. We also welcome the recommendation that there must be a coordinator of hospital boards and clinic committees in the respective MEC's offices. I'm committing on behalf of the MECs that will go back and make sure that it happens. Again, this will only serve to strengthen our oversight and overall good governance at our different healthcare facilities. And last but not least, we would like to thank the Board of Healthcare Funders, the Innovative Pharmaceutical Association of South Africa, the Clinton Health Association Initiative, Right to Care, as well as ASPED for supporting this summit and making it possible. In short, I want to thank every single one of you who participated, who is in this summit today, for making it possible for it to be able to be a success. Thank you very much. That's the end of our session. I would then just request that we allow the President and the Minister to step off the stage and request that the MECs with the DG and those that have been indicated to know, can you please follow the President and the Minister, and the rest of us have a good time, travel safe, and enjoy your trip back home. We will enjoy ukuba segoli. Okay, someone left their key. I will leave it with Dr. Anban. All right. And then immediately after this, all of us are requested to go out for lunch. I think that is where we had lunch yesterday. I will just wait for the delegation to go with the President, and then all of us will be able to go and have lunch finally. Okay. And we were very good audience to have.
Thank you.